Assalamualaikum and hello everyone. My name is Nur Suliza binti Muhammad Yunus. My OUM ID is 860925335786. I am a student in the field of Bachelor of Management at OUM Kuala Selangor Learning Centre. Today I will talk about scope personal health in terms of mental health topic, and the subject matter is about depression. In this video, I will give an instruction speech of how to treat depression. The rise in suicide rates in Malaysia is in line with the rise on the number of COVID-19 cases in the country. Movement Country Order MCO starting from March 2020 to October in 2020 forfeit a total of 266 people committed suicide with an average of 60 cases a month or one every day. Those who eventually die of depression make suicide as their last resort. Quoted from an article by Minderjit Kaur, MCO implemented with the aims to help reducing the number of COVID-19 cases. However, the lack of interaction among us pushes strongly towards mental health problems, starting from anxiety and eventually depression, which is contributing to the rising suicide rate in the country. Therefore, today I would like to share steps that can be taken to treat depression that may help you. What is depression? Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with a person's everyday activities. People experience depression in different ways. It may interfere with your daily works, resulting in lost time and lower productivity. It can also influence a relationship and some chronic health conditions. Conditions that can get worse due to depression include arthritis, asthma, cardiovascular disease, cancer, diabetes, and obesity. Depression symptoms. Depression can be more than constant state of sadness or feeling blue. Major depression can cause a variety of symptoms. Some affect your mood and others affect your body. Symptoms may also be ongoing or come and go. The symptoms of depression can be experienced differently among men, women, and children differently. May experience symptoms related to their mood, emotional well-being, behavior, sexual interest, cognitive abilities, sleep patterns, and physical well-being. Depression causes. There are several possible causes of depression. They can range from biological to circumstances. Common causes include family history, early childhood trauma, brain structure, medical conditions, and drug use. Treatment for depression. Living with depression can be difficult, but treatment can help improve your quality of life. Talk to your healthcare provider about possible options. The Headline Find Care tools can provide options in your area if you don't already have a doctor. You may successfully manage a symptom with one form of treatment, or you may find that a combination of treatments work best. It's common to combine medical treatment and lifestyle therapy, including the following: medication, physical therapy, light therapy, alternative therapy, exercise, avoid alcohol and drugs. Take care of yourself. 10 ways to treat depression without medication. For many people living with depression, prescription medications can be wonder drugs. Number 1. Get more sleep. Sleep and mood go hand in hand. Get too little of the former and the latter is bound to flag. This means you keep consistent bedtimes and wake up times. Your bedroom is set up for sound sleep. You have a relaxing bedtime routine and doesn't involve sitting in front of the screen and so on. Whether you cannot seem to get any sleep or cannot seem to stop sleeping, there are steps you can take to try to improve the quality of your sleep. Number 2, cut back on caffeine. Coffee, tea, soda and even chocolate are steeped in caffeine. It's fine to indulge in a reasonable amount of caffeine in the morning. But if you do, don't consume caffeine after late afternoon so it doesn't interfere with sleep. Number 3, get more vitamin D. This some evidence that a deficiency of this important nutrient could play a role in depression. If you aren't getting enough vitamin D through your diet and lifestyle, for example, like sun exposure, ask your doctor if you should try taking a supplement. Number 4, tap your spiritually. No need to join a church or mosque, although certainly for many people dealing with depression, religion can be an impactful source of support. But simple daily practice such as meditation or adding to a list of these you are grateful can help boost mood and overall well-being. Studies also suggest that different type and mindfulness meditative practice can also be effective in the treatment of depression. There are many different types of meditation, but you can get started with a simple meditative exercise. Sit comfortably, close your eyes, breathe naturally, focus on how your body feels while you breathe. When your mind wanders, redirect attention back to your breathing. Number 5 is get more exercise. This doesn't mean train for a marathon, but it does mean putting in a half hour or so of low intensity activity each day, which has been found to be effective in improving mood and quality of life. Number 6 is avoid alcohol. Alcohol in and of itself is a depressant. Oddly enough, drinking can interfere with sleep, and quality sleep is a key to battling the blues. While alcohol might seem like a quick fight to escape that you are feeling, it can actually make many of the symptoms of depression feel much worse. And number 7 is eat good mood food. What you put in your mouth can have a direct effect on how you think and feel. Make sure you eat a well-balanced diet and that's rich in nutrients and low saturated fat. A nutritionist and dietitian can help you analyze your eating habits and pinpoint potential nutrient deficiencies that could contribute to depression. Number 8 is change your throat. One of the most popular and effective treatment used in the treatment of depression is cognitive behavioral therapy. Number 9 is get a handle on stress. Stress can drive up level of the brain chemical called cortisol, which has been found to be higher in folks with depression. There are lots of strategies for coping with stress, such as time management, meditation, and biofeedback training. And the last one is tend to your social life. When you are depressed, there are no reason to go it alone and all sort of reason to reach out to family and your friends. What happens if depression is not treated? When you left untreated, depression can have serious consequences. If left untreated, depression can have a serious and sometimes long-term consequences that can affect every aspect of your life. Fortunately, depression is treatable, but by getting help and following your treatment plan, you can prevent this complication. Suicide, addiction, self-injury, reckless behavior, poor school performance, relationship problems, and health concerns. Preventing depression. Depression is not generally considered to be preventable. It's hard to recognize what caused it, which means preventing is more difficult. In the end, preventing is better than cure, but it is still not too late to cure ourselves. If you feel you need help and mental support, reach out to the Love Line line helpline initiated by the Women, Family and Community Development Ministry. This helpline is one of the minister's efforts to provide physiological support to those affected due to mental health. I hope my sharing today will benefit you to keep your warmth during your hard time. Thank you.